in my own experience, most patients need a lower dose. I
Yeah.
think the starting approved dose is 100 milligrams. We also know those were mostly based on the second line setting where you need a higher concentration to overcome resistance. In the front line setting, maybe you don't need quite as much, but I stress that it's an individualized dose and not everybody is gonna need the same dose. We don't all respond to medicines in the same way. So I think holding that drug is a very important point, giving permission, giving the recommendation
Yeah.
that we need to stop, reset, lowering the dose if we need to. Mary and Laura, how are patients sometimes concerned about doing that?
Another thing I think is really important to point out to patients is that the way they're feeling and the way their personality has changed for whatever way, it's actually the cancer drug that's causing it, not the cancer.
Right.
So I think that's meant to say I think that's an important differentiation. And then yes, patients are they're afraid, but they trust us. So we remind them that we want what's best for them and what's best for their life, and that it's a short, stopping withholding it's for a very short duration, and there is a plan to reintroduce it, but at a different dose. And numbers are determined, but their safety is important to keep them well and to prevent them from harm, in whatever harm means for them. And actually talking through them why they're afraid of stopping. Like they may have a family wedding in 2 months' time that they desperately want to get to, and that that you're just understanding why they're afraid to stop, and reiterating the same message that it's it's because of the drug. We will not deny them access to a drug that's going to manage their cancer, or we're on the same team.
One of the things I've noticed is, and maybe it's the way I'm communicating with the patient, if particularly patients have brain mets, I will emphasize, because they may have heard that, traditionally we do radiation, and many of our patients who have asymptomatic brain metastases, nowadays we just rely on, especially in diseases like ALK-positive lung cancer, on the TKIs to manage not just the systemic disease but the brain mets. And I feel that they are very concerned that even holding a day or two of the drug may actually make their brain metastases worse. And so I think patients with brain mets, when in one way it's nice to be able to just treat them with one treatment and not have to go for radiation. But on the other hand, they feel like, okay, maybe I need even more to be more regular with my treatment, and may have some hesitation of holding the drug. So,
Laura, have you ever seen sort of hesitance to stop or dose reduce or take breaks in treatment?
Oh, absolutely, absolutely. And to that, I would tell patients, it's a marathon, not a sprint here. We want you to have the best quality of life for as long as possible. If we keep you alive and you're miserable, what is that? So, and the holding for a couple days is not going to make a big difference in the long term. And so I think patients are generally receptive to that idea. Then they understand, like Mary said, we're doing this for safety, we're doing this to support them and make sure they have a long-term good quality of life and keep their cancer under control.